Hello, everybody. That's Vincenzo Piccolo from the Dermatology Unit of University of Campania, Luigi Vanvitelli from Naples. And in this brief video today, I'm going to talk about reflectance confocal microscopy in children. That is quite novel topic, and a few data coming from a new study that we performed at the university with application and limits in the children as well. This is the paper that is just published on the experimental dermatology on October 2022. This paper regards the application of reflectance confocal microscopy, that is a non-invasive diagnostic tool, quite novel in dermatology. It consists in the application of an infrared diode laser on the skin that reach a superficial part of the skin and allows the visualization of the papillary dermis and the superior reticular dermis. The study was designed in such a way. It was an experimental retrospective study conducted on patients, children that undergone to confocal microscopy between January 2011 and December 2021. Only patients younger than 19 years old were selected for this study. We recruited a total of 215 patients in this study, and information about clinical features of the lesion, demographics, suspicion, final diagnosis, and outcome were collected in the study as well. This is the abstract of the paper. I'm attaching you also a picture of the instrument used for the confocal microscopy, i.e. the Vivascope 3000, that is the most used in practice. As you can see here, just in the results, that what comes from this study is that the investigation was mostly used for the detection and for differential diagnosis of melanocytic lesions such as Spitz nevi, congenital nevi, atypical melanocytic lesion. But let's go through the study to understand better the results and the final remarks of the study itself. These are the results. As I told you before, 215 patients were selected, so a large series of patients in 10 years, considering that these patients were just children, and the methodic is widely diffused among adults. The mean age was 12 years, just indicating that probably the peripubertal age most benefits from this study. We had a slight predomination of females in the study. In fact, 129 females were present among the patients, compared to 86 males. These are the most common locations. Lower limbs, first of all, most lesions were located on lower limbs, followed by head and neck area, and then dorsal region. Main diagnosis at the beginning, before procedure, includes Spitz nevi. So we sent to confocal microscopy patient when we thought that they had Spitz nevi, congenital nevi, and atypical nevi in 46 cases. And this is probably the most important data emerging from the study, i.e. that the rate of excision after reflectance confocal microscopy in pediatric patients was 14.9%. So about 15% of patients after the procedure were sent to excision. two melanoma and two atypical Spitz tumors were found in the study, so confirming the data that this kind of tumors are very uncommon in this age category. Just some details about the diagnosis. As I told you before, 40% of the investigated lesions were Spitz or reed nevi, followed by congenital nevi and atypical melanocytic nevi. Then we have a few inflammatory disorders such as alopecia and vitiligo, and after that, other common lesions such as pyogenic granuloma, dermatofibroma, angioma, and some infectious disease such as tinea corporis and warts that were studied through reflectance confocal microscopy. This is a picture of one of the two atypical Spitz tumors here affecting an adolescent, a 17-year-old boy with a very atypical dermatoscopic findings with this central blue whitish veil surrounded by atypical network and globules. At the confocal microscopy, an atypical combustal pattern at the level of the suprabasal layer was seen, along with these nucleated roundish cells in the epidermis indicated by white arrows. This lesion was excised and it was an atypical Spitz tumors. On the other hand, the reflectance confocal microscopy allowed to avoid biopsy in such a typical lesion such as halo nevi. Halo nevi was seen in this 13-year-old girl that's atypical at dermoscopy, but not such atypical at confocal microscopy, showing inflammatory cells and dense clots, very typical of the halo, so permitting to avoid the biopsy in this case. So, which is the conclusion of the study and the perspectives for the future? First of all, we can consider reflectance confocal microscopy in pediatric age well tolerated because it is a non-invasive technique, so well accepted by parents and children as well. We have just one limit. It is a motionless procedure lasting at least 20 minutes with the old devices, probably less with the new devices. So probably for small, younger children, it could be more difficult and challenging to require this motionless time, but this is probably the only one limit of the procedure. This is the most important data of our study, that RCM avoided biopsy in 85% of the case studies. So it was a high rate of an avoidance of biopsy, concerning that the reflectance confocal microscopy is a third level investigation where just selected patients were sent when there was a suspicion. We can consider it just indicated in the differential diagnosis of melanocytic lesion, just like it happens also in older patient as well, and it is not indicated for deep lesions such as dermatofibroma, although some dermatofibroma were investigated through this technique, but because of a technical limit concerning the ability of the technique not to go in the skin, we cannot expect to find some very typical findings in deep lesions of the skin. And finally, we can consider it as an additional non-invasive tool in the differential diagnosis of cutaneous diseases in children. Thanks for listening and see you next time.